self-injury, parent training, and communication-based treatment, as well as individual psychotherapy. Autism. Autism spectrum disorder. Treatments for autism include intensive behavior treatment, a snug vest, behavioral technique, pervasive developmental pivotal response training, PRI, response interruption and redirection, RIRD, differential reinforcement of other behavior, LOVAS model, early intensive behavioral intervention, EIBI, applied behavior analysis, ABA, parent delivered developmental social communication intervention and social skills training, manualized parent delivered program language intervention. Techniques for treating autism include social development, focusing skills, sensitivity to cues, modeling communicative skills, and predictable play. ADHD, attention deficit hyperactivity disorder. Treatments include randomization, controlled therapies, RCT, behavioral parent training, BBT, behavioral classroom management, BCM, stimulant medications, parent training, counseling, behavioral targeted classroom intervention, social skills, interferes with functioning in social, academic, and occupational domains. Education, attention management training, behavioral management training, social skills training, anger management training, and problem solving training. Techniques for treating ADHD include individual counseling, group, client education, parent counseling education, pharmacological treatment, CNS stimulant, school intervention, and social skills training. Tic disorder. Treatments include comprehensive behavior intervention for tics, CBIT. Schizophrenia. Schizophrenia spectrum and other psychotic disorders. Disorder. Schizophrenia. Cognitive behavioral is one of the techniques. Some of the other techniques for treating schizophrenia are social skills training, psychiatric management, antipsychotic medication, social skills training, family therapy, individual counseling. Therapies include family therapy, group, individual, pharmacotherapy, psychodynamic therapy, psychoeducational approach. Techniques include cognitive behavioral social skills, problem solving skills, social skills training, as well as family psychoeducation. Bipolar and related disorders. Bipolar 1 treatment, CBT, interpersonal therapy, interpersonal social rhythm therapy with medication, combination, family focused, and CBT, psychoeducation, medication first line, rhythm therapy, group therapy during recovery, other treatment recommended. DBT has some support. Combination treatment, family focused therapy, FFT, IBPT with social rhythm therapy, and CBT. Day treatment, group therapy, self-help groups, electroconvulsive therapy, and vagus nerve stimulation. Techniques include bipolar disorder for adults. Medication is the first line. Family psychoeducation, family-focused psychoeducation, IPSRT with social rhythm, circadian rhythm, family-focused therapy. family psychoeducation, family-focused psychoeducation, IPSRT with social rhythm, circadian rhythm, family-focused therapy. Bipolar techniques include CBT therapy, interpersonal, psychodynamic therapy, rational emotive behavioral therapy, cognitive behavioral therapy, family intervention with behavioral therapy, family treatment, pharmacological agents, and psychoeducational. Cyclothymic disorder. Treatments proven to be helpful are IPT, FFT, regulating sleep, circadian rhythms, and social rhythm. Supplements may be career counseling and interpersonal skill development. Group counseling may be useful. First-degree relatives of people with cyclothymic disorder have increased incidence of bipolar disorder. Childhood history of being hypersensitive, hyperactive, and moody. Regulate sleep, circadian rhythms, and social rhythms. Thus, interpersonal social rhythm therapy, IPSRT, family-focused therapy, FFT, and cognitive behavioral therapy. Therapies include cognitive behavioral therapy and psychoeducational approach. Adjustment disorder. Depressive disorders. Adjustment disorder, 6 types of treatments, individual outcome studies recommended, brief therapies, solution focus, miracle question, DBT, parent management training, when children are the clients, crisis intervention, model relieving acute symptoms, brief psychodynamic psychotherapy, problem solving, techniques, coping skills training, crisis intervention, psychoeducation, stress inoculation, solution-focused therapy, problem-focused therapy, DBT, cognitive behavioral therapy, family therapy, group therapy, multisystemic therapy, parent management training, pharmacologic agent to deal with insomnia, psychodynamic therapy, psychoeducational and supportive therapy for adjustment disorder. DMDD, disruptive mood dysregulation disorder. Treatment includes medication and psychotherapy, instrumentation, disruptive mood dysregulation disorder, child behavior checklist, dysregulation profile, CBCLDP. Disruptive mood dysregulation, DMDD. Treatment, medication, and psychotherapy. Instrumentation, disruptive mood dysregulation disorder. Child behavior checklist, dysregulation profile. Major depressive disorder. Treatment, low level of social functioning. Clients perform best with interpersonal psychotherapy, behavioral activation therapy, BAT, CBTI, insomnia, mindfulness, exercise, and vagus nerve therapy. Emotion regulation skills and a skills-based mode of adaptive coping with emotions. Treatment, Children's and Adolescents, CBT Penn State Program, Self-Control Therapy, Coping with Depression, Adolescent and Interpersonal Therapy, Adolescent Met, Probably Efficacious. Experimental Interventions, Individual Video Self-Monitoring, one study, Parent-Child, Primary and Secondary Control Enhancement Training, Stress Busters, Family Systems, Child Group plus Parent Intervention, Systems Interrogative, Family Therapy, Group, Child-Only Relaxation Training, Child Group plus Parent, Teacher Consultation, and Social Skills Training. Major Depressive Disorder Therapies, Cognitive Behavioral Therapy, Interpersonal, Pharmacologic Treatment, Psychodynamic Therapy, Techniques, Cognitive, CBT, Interpersonal, Psychotherapy, Mindfulness-Based Cognitive Therapy, BCT, Exercise Therapy, Light Therapy, Medication. PPD, Persistent Depressive Disorder, Treatment, Cognitive Behavioral Therapy, Interpersonal Therapy, Social Skills, Assertiveness, and Decision Making. Separation anxiety, anxiety disorders. Anxiety disorders. Treatment, disorder treatments for anxiety disorders, separation anxiety, SAD. Children, individual cognitive behavioral therapy, ICBT. Group cognitive behavioral therapy, GCBT. GCBT with parents. Group cognitive behavioral therapy for social phobia, and SET for SOP. Exposure therapy, coping CAT model, which is a manual design. Techniques for treating separation anxiety, which is a type of anxiety disorder, is anger management, parent management, and problem solving. Generalized anxiety disorder, GAD. Treatment includes cognitive behavioral treatment. Cognitive restructuring is frequently used. Behavior therapy, acceptance-based behavior therapy, ABBT. Techniques include cognitive restructuring, relaxation training, emotion regulation, exposure techniques, problem solving, muscle relaxation, guided imagery, diaphragmatic breathing, expressive therapy, systematic desensitization, CBT, ACT, cognitive therapy, behavioral therapy, cognitive behavioral therapy, and pharmacological treatment, anti-anxiety agent. Social anxiety disorder. Social anxiety disorder, social phobia treatment. Group cognitive behavioral therapy for social phobia, SLP, CBT, ACT. Techniques. Social phobia, weekly summer scale. Social cognitions questionnaire. Exposure alone. Cognitive restructuring. Exposure combined with cognitive restructuring. Social skills training. Attentional focus training. Homework. Applied relaxation. Anxiety management. Mindfulness. Flooding. In vivo. Imaginal. Psychoeducational. Exposure to fear situations. Anxiety coping skills. Problem solving. Cognitive behavioral models, cognitive group therapy, social effectiveness therapy, SET, interpersonal psychotherapy, IPT. Social phobia therapies might be treated using behavioral therapy, cognitive behavioral therapy, group, and psychodynamic therapy, interpersonal. Panic disorder. panic disorder. Treatment includes cognitive behavioral therapy, which is treated at 8 to 12 sessions, and brief cognitive therapy. OCD, obsessive compulsive and related disorders. Treatment includes exposure and response prevention therapy, cognitive behavioral therapy, specifically targeting errors in thinking, reframing, ACT. For children, treatments include exposure-based ICBT, family-focused ICBT, and family-focused group cognitive behavioral therapy, designs and protocols, psychodynamic psychotherapy. Therapies include behavioral therapy, cognitive therapy, exposure therapy, pharmacologic treatment, psychodynamic therapy, rational emotive response prevention. Techniques for treating OCD include cognitive behavioral therapy, acceptance and commitment therapy, ACT, exposure, cognitive restructuring, mindfulness, response prevention, ERT, acceptance, diffusion, self as context, present moment awareness, committed action, habituation, parent intervention, and relaxation training. Body dysmorphic disorder. Treatment includes cognitive behavioral therapy, cognitive therapy, CT, reflective therapy, and group therapy. Instruments include the Brown Assessment of Belief Scales, techniques, verbal expression, stress management, and therapy includes cognitive behavioral therapy. TTM, trichotillomania, which is hair pulling. Treatment includes being individually tailored to the client with an established baseline and begins at the start of the response chain. Response interruption is another strategy to eliminate the hair pulling. Habit reversal is an empirically supported behavioral approach. The client is encouraged to self-monitor through record keeping of urges and emotions experienced. Cognitive therapy, group therapy. Techniques include psychodynamic therapy, supportive therapy. PTSD, post-traumatic stress disorder. Treatment includes emotion-focused cognitive behavioral, trauma-focused CBT for sexually abused children, exposure therapy, EMDR, evidence-based meta-analysis, cognitive processing therapy, CBT, CPT is recommended for survivors of sexual assault and traumatic brain injury and for post-traumatic stress disorder. It has also been used for anxiety management training. Other treatments for post-traumatic disorder include group, family therapy, and stress inoculation training. Evidence-based treatment, child and adolescents, trauma-focused behavioral therapy, TFCBT, school-based group, cognitive behavior intervention, resilient peer treatment, RPT, family therapy, FT, and client-centered therapy, cognitive processing therapy, child-parent psychotherapy, cognitive behavioral therapy for post-traumatic stress disorder, eye movement desensitization and reprocessing, EMDR. Techniques for PTSD include abreactive therapy, art therapy, CBT, eye movement desensitization, flooding, group, hypnosis, neurolinguistic programming, pharmacotherapy, psychodynamic therapy, psychoeducation, therapies, psychoeducation, prolonged exposure therapy, imaginal exposure, stress reduction, exposure therapy, stress inoculation, adaptive coping, DBT, ACT, EMDR, stress reduction. Dissociative identity disorder. Dissociative disorders. Treatment includes long-term individual psychotherapy, has been found to be effective but is rarely used because of the time limitations that prevail at this time. Individual therapy and medication, antidepressants, and analytic medications. Somatic symptom disorder. Somatic symptom and related disorders. Burkitt syndrome. Treatment includes affective cognitive behavioral therapy, ACBT, group and family therapy. Forms include conversion, pain, hypochondrias, and body dysmorphic. Treatment will vary depending upon form. For example, IPTP and CBT for pain, or HRT for skin scratching and picking. Techniques include relaxation exercises, sleep hygiene. Therapy includes combination of psychodynamic therapy and psychoeducational approach. Treatment mostly rests with the primary care physician. Factitious disorder. Factitious disorder includes treatment, stress management. Feeding and eating disorders, anorexia. Treatment includes emotion-focused therapy, multidisciplinary approach, cognitive behavioral therapy, DBT for bed, active comparison group therapy, ACGT, anorexia nervosa. Behavioral therapy, cognitive therapy, psychotherapy including dietary management, family therapy, group therapy, psychodynamic therapy. Techniques for feeding and eating disorders includes Mosley's model, family organization and interaction, facilitates eating and weight gain, parables, paradoxes, personal authority, rationalizations, psychodynamic interpretation, and homework. Anorexia nervosa. Treatment includes Mosley's family-based multidisciplinary approach, cognitive behavioral therapy, DBT, group therapy, transdiagnostic approach, interpersonal psychotherapy, family therapy. Treatment is for child and adolescents. Family therapy, psychoanalytic therapy, Cash's body image therapy, family therapy for BN, CBT, guided self-care, for binge eating, and BN. Bulimia nervosa. Bulimia nervosa, cognitive behavioral therapy, family therapy, interpersonal psychotherapy, psychodynamic therapy, psychoeducational approach. Techniques for bulimia, which is a type of feeding and eating disorder, are CBT, routine eating, structured eating, monitoring of food intake, exposed-based methods, weighing, cognitive restructuring, as well as food diaries. Bulimia. Bulimia nervosa. Treatment includes manualized based CBT treatment, which is preferred, DBT for BED, IPT, interpersonal therapy, CBT, greater decreases in vomiting and restraint medication, fluoxetine restraint, weight concern, food preoccupation, improvement in nutritional management, decreases in binge eating and vomiting, abstinence from binge eating and medication, fluoxetine restraint, weight concern, food preoccupation, improvements, trazodone decreases in frequency of binge eating, vomiting, and in fear of eating, and anticonvulsants. DBT, CBT, focus on therapeutic alliance, reducing negative affect, modifying eating behaviors, and identifying situations that trigger behavior. Binge eating disorder. Binge eating disorder treatments include cognitive behavioral therapy, interpersonal therapy, DBT, eating disorder techniques, mindfulness and acceptance, cognitive behavioral, routine weighing, food diaries, exposure, structured eating, behavioral experiments. Sleep-wake disorders. Sleep-wake disorders. Treatments include psychopharmacologies, CBT, bright light therapy, sleep education, sleep hygiene, and sleep restriction. Stimulus control, cognitive restriction, paradoxal intention, relaxation, relaxation therapy, cognitive behavioral therapy for insomnia, CBTI behavior treatment, relaxation therapy, including progressive relaxation, biofeedback, and cognitive thought stopping. Positional therapy, head elevated, can be recommended for sleep apnea. Techniques, insomnia, CBT, sleep hygiene, sleep diary, relaxation exercises, muscle relaxation, autogenic training, sleep, scheduling, sleep restriction, paradoxal intention, thought stopping, and problem solving. Therapies include CBT and psychodynamic therapy. Insomnia. Insomnia. Treatment includes CBT-1, stimulus control, sleep restriction, and common sense. Treatment for insomnia includes physical and psychological approaches. Physical approaches include pharmacology, bright light therapy. Psychological approaches include CBT, most effective, bibliotherapy, sleep education, sleep hygiene, sleep restriction, cognitive restructuring, paradoxal intention, and relaxation therapy, which is a common technique. Pharmacological treatment using hypnotic and antidepressant medications are also common. Trazodone and amitriptyline. Narcolepsy, which is a type of sleep disorder, might be treated using group therapy. Sexual disorders. Sexual dysfunctions. Disorder, female sexual interest arousal disorder. Treatment includes education, Eros clitoral therapy device, which increases blood flow, emotion-focused therapy, couples and group therapy can be appropriate, relational therapy, 12-step program modeled after Alcoholics Anonymous, Sex Addicts Anonymous, Sexual Compulsive Anonymous, and Sex and Love Addicts. Male hypoactive sexual desire disorder might be treated using marital counseling, psychotherapy, genital pelvic pain penetration disorder. Might be treated using behavioral therapy, cognitive therapy, psychodynamic therapy, interpersonal. Conduct disorder, disruptive impulse control and conduct disorders. Treatment includes problem solving, skill training, PSST, dysregulation, impulsivity, social skills, anger management, and parent management. Treatment for children and adolescents include evidence-based efficacious treatments, which include well-established efficacious parent management training, Oregon Mode PMTO, anger control training, group assertive training, helping the non-compliant child HNC, Incredible Years parent training, Incredible Years child training, Incredible Years multidimensional treatment, foster care, multi-systemic therapy, parent-child interaction therapy, positive parenting program, triple enhanced treatment, problem-solving skills training, PSST plus practice, PSST plus parent, PSST plus PMT. Rational Emotive Mental Health Program, REMHP, problem-solving skills training, PSST, dysregulation, impulsivity, social skills, anger management, as well as parent management. Substance abuse, substance-related and addictive disorders, alcohol use disorder, treatment, evidence-based treatment for adolescent substance abuse, interventions include individual CBT, 7 replication studies, group CBT, 13 replications, family therapy, 17 replications, and 9 minimal control condition studies. The results included well-established WE, multidimensional family, MDFT, functional family therapy, FFT, group CBT, multisystemic therapy, brief strategic family therapy, behavioral family therapy. Researchers recommend combined behavior interventions, motivation enhancement, cognitive therapy, social skills training, cognitive restructuring, relaxation training, stress management, 12-step, and family therapy. Techniques for substance abuse include behavioral therapy, cognitive therapy, family therapy, group therapy, psychodynamic therapy, psychoeducational approach, alcohol use related, cognitive behavioral, cognitive, cue exposure, urge coping, self-control training, brief motivational, stress management, supportive expressive therapy, exposure prevention, homework, cognitive restructuring, maladaptive thinking, relapse prevention, problem solving, social skills training, ITP. Delirium. Delirium, neurocognitive disorders. Treatment includes medication to slow the progression, support for caregivers, therapies, cognitive therapy, psychoeducational approach. Techniques include support for caregivers, relaxation training, and coping skills. Personality disorders. Treatment includes psychodynamic, cognitive behavioral, DBT, dialectical behavioral therapy, mindfulness, metallization focus, schema therapy, borderline personality disorders, support therapy, supportive psychotherapy, cognitive behavior therapy, dialectical behavior therapy, interpersonal psychotherapy, and systems. Training for emotionally predictable and problem solving, STEPPS, psychodynamic, psychotherapy, integrative psychotherapy, mentalization-based therapy, MBT, and group therapy. Techniques include psychoeducation, cognitive behavioral, DBT, schema therapy, attachment therapy, and mentalization. Paranoid. Cluster A. Appear odd or eccentric. Disorder. Paranoid personality disorder. Treatment is minimal effectiveness studies available. Individual treatment preferred. Cognitive therapy. Group therapy rarely recommended. Behavioral therapy. Psychodynamic therapy. Schizophrenia spectrum disorders. Schizoid personality disorder. Treatments include schema therapy, behavioral techniques such as social and communication skills. Schizotypal personality disorder. Treatment includes supportive therapy, lengthy and slow, cognitive therapy, behavioral therapy for speech patterns. Antisocial conduct disorder. Antisocial personality disorder. Treatment includes individual therapy with a structured and active approach to therapy is recommended. Some support for reality-based approach for anger management, substance use disorders, social skills training, mentalization-based therapy, and schema therapy hold promise. Behavior, reality, cognitive approaches are helpful. Non-psychotic adults, family, cognitive behavior, psychodynamic therapy, various approaches. Conduct disorder. Treatment includes social skills training, relaxation exercises, impulse control, negative talk, family therapy, active attention skills, active ignoring skills, parent training, setting limits, physical affecting, attention, planned ignoring, as well as children with conduct disorder. Treatment includes family therapy. Borderline personality disorder. Treatments include dialectical behavior therapy, DBT, mentalization-based therapy, transference focus therapy, schema focus CBT, supportive psychotherapy, STEPP group therapy. Group therapy can be more effective than individual therapy, especially schema focused therapy, SFT group, and psychodynamic psychotherapy. Therapies: cognitive behavior therapy, dialectical behavior therapy, supportive therapy. Histrionic personality disorder. Treatment: long-term individual psychotherapy, cognitive behavior therapy as a treatment of choice. Group therapy can be helpful. Feedback. Therapies for histrionic personality disorder: behavioral therapy, cognitive therapy, marital group, psychoanalysis, psychodynamic therapy. Narcissistic personality disorder. Treatment includes psychoanalytic anger, envy, self-sufficiency. Cognitive behavioral, group therapy if all members are narcissistic and can tolerate the exposure and negative feedback. Therapies, cognitive behavioral therapy, psychodynamic therapy, supportive. Avoidant personality disorder. Treatment includes randomized and controlled trials, effective for psychodynamic psychotherapy, behavior interventions, schema-focused therapy, group therapy, and family therapy may be helpful. Dependent personality disorder. Treatment includes psychodynamic, cognitive behavior therapy, schema therapy can be helpful, instrumentation, Million clinical multi-axial inventory, MMPI, structured clinical interview. Therapies, cognitive behavior, psychodynamic therapy. Brief psychotic disorder. Brief psychotic disorder treatment includes the different types of brief psychotic disorders include schizophrenia, schizophreniform, delusional, and schizoaffective. Treatments include randomized and controlled trials, which indicate behavior and psychosocial therapies, preferred for schizophrenia along with antipsychotic medications. Crisis intervention is helpful as these clients are often in crisis. Clients diagnosed with schizophrenia and psychotic symptoms treated with medication should also be treated with CBT and ACT to reduce the severity of symptoms. Therapy, psychoeducational approach, cognitive behavioral therapy. Schizophrenia, schizoaffective. Schizophrenia treatment includes medication and psychosocial intervention, behavior therapy, skills training, social support, and group therapy can be helpful in providing information. Schizoaffective treatment, psychotherapy, concrete, supportive, build social skills, family-focused therapy where appropriate, family systems exist, psychoeducation, medication management, treatment, couples, emotion-focused therapy, relational clinical attention. And that's a brief overview of some of the counseling intervention techniques.